How losing a loved one can impact our mental health. Understand how grief affects mental health, what are the most common symptoms, and how to deal with the pain of loss in a healthy manner. Losing a loved one is undoubtedly one of life's most painful experiences. It's natural for sadness and longing to overwhelm us at this time. But have you ever stopped to consider that grief, besides affecting us emotionally, can also have a significant impact on our mental health? Imagine grief as a giant wave crashing down upon us. Just as this wave churns up a whirlwind on the surface of the sea, the loss of a beloved person triggers a storm of emotions within us, potentially affecting our mental balance. In this article, we'll explore how the death of a loved one impacts our mental health and provide you with tips for handling these challenges in a healthy manner. Grief, a natural yet painful process. Grief is a natural and healthy reaction to a significant loss. It's a gradual process that allows us, bit by bit, to emotionally detach from the person who has passed away and move forward with our lives. However, this process can be lengthy, complex, and filled with ups and downs. Common emotional symptoms during grief. It's natural to experience a wide range of emotions during grief. Some of the most common emotional symptoms include profound sadness. Profound sadness is the prevailing emotion in grief. You may feel an emptiness, a sense of loss, and a profound despondency. Anger. It's common to feel anger directed towards the deceased person, oneself, God, or the world at large. This anger is a way of expressing the frustration and injustice of the loss. Guilt. Feelings of guilt may arise, as if something more could have been done to prevent the death of the loved one. It's important to remember that guilt is a complex emotion, and that we don't always have control over everything. Anxiety. The uncertainty of the future and the anguish over the loss can generate anxiety, leading to symptoms such as restlessness, intrusive thoughts, and difficulty relaxing. Denial. In some cases, a person may deny the death as a way to shield themselves from the initial pain. It's important to respect each person's timing, but prolonged denial can hinder the grieving process. Social isolation. Sadness and emotional pain can lead to withdrawal from loved ones. However, social isolation can exacerbate grief symptoms. When grief turns into depression. Although sadness is common in grief, it's important to be attentive to signs of depression. Depression is a mental disorder that presents more persistent and incapacitating symptoms, such as profound sadness that doesn't improve over time, loss of interest in activities that were once pleasurable, changes in appetite and sleep increase or decrease, difficulty concentrating and remembering, suicidal thoughts or thoughts of death. If you're experiencing these symptoms, it's crucial to seek professional help from a psychologist or psychiatrist. They can assist you in dealing with the pain of loss in a healthy way and offer the necessary support to overcome this difficult time. Grief and anger, expressing pain in a healthy way. Anger is a common emotion during grief. Denying or repressing anger can be detrimental to mental health. However, it's important to find healthy ways to express this emotion, such as engaging in conversation with a friend, family member, or therapist. Sharing your anger with a trusted individual can help you process the emotion constructively. Journaling. Writing about your anger can be a cathartic way to release it. Physical activities. Engaging in regular physical exercise releases endorphins, hormones that combat stress and anger. Grief and guilt, forgiving yourself and moving forward. Feeling guilt after the loss of a loved one is common. You may question if you could have done something differently to prevent the death. It's important to remember that guilt is often based on irrational thoughts, and that we don't always have control over everything that happens in life. To deal with guilt, practice self-forgiveness. Allow yourself to recognize that you did the best you could in the situation and focus on what you can control, taking care of yourself and honoring the memory of the person. Grief and social isolation, seeking support and connection. Feeling more introverted during grief is natural. However, prolonged social isolation can exacerbate grief symptoms and hinder the healing process. It's important to seek support and connection with others, such as sharing your pain with friends and family. Talking about your loss and your feelings can help you feel less alone. Joining a grief support group. There are support groups for people who are experiencing grief. Sharing your experiences with others who are going through the same situation can be very comforting. Seeking professional help. A psychologist or therapist can assist you in dealing with the pain of loss and provide you with tools to cope with social isolation. Grief and faith, finding strength and comfort. Faith can serve as a wellspring of strength and solace during grief. For some, believing in an afterlife can bring hope and tranquility. Engaging in religious rituals or connecting with one's faith community can be a means of finding support and meaning during this challenging period. Guidelines for nurturing your mental health during grief. Allow yourself to experience the pain. It's crucial to allow oneself to feel the pain of loss in order to process it and move forward. Don't attempt to suppress your emotions. Express your feelings in a healthy manner. Talk to friends, family, or a mental health professional about how you're feeling. Take care of your body. Nourish yourself with healthy food, engage in regular physical exercise, and ensure an adequate amount of sleep. Avoid alcohol and drugs. The use of alcohol and drugs can exacerbate grief symptoms. Seek professional help. If you're struggling to cope with grief, seek professional assistance from a psychologist or psychiatrist. Losing a loved one is a painful experience that can affect our mental health in various ways. It's important to understand the symptoms of grief, seek social and professional support when needed, and take care of your physical and mental health during this period. With time, support, and proper care, you can overcome the pain of loss and move forward with your life. Frequently asked questions. Question 1. How long does grief last? The duration of grief is individual, and there is no magical formula. Some may require months or even years to overcome the loss of a loved one. It's important to respect your own pace and not compare yourself to others. Question 2. How do I differentiate normal grief from depression? While sadness is common in grief, depression presents more persistent and debilitating symptoms. If you're having difficulty performing your daily activities, feel hopeless, or have suicidal thoughts, seek professional help from a psychologist or psychiatrist. Question 3. What can I do to help a child who is grieving? Explain death clearly and honestly according to the child's age. Allow them to express their feelings and answer their questions honestly. Create a safe and nurturing environment and maintain the child's routine as much as possible. Seek professional help if the child struggles to cope with grief. Question 4. How can faith help me cope with grief? Faith can be a source of solace and strength during grief. For some, believing in an afterlife can bring hope and peace. Faith can also provide a sense of community and belonging, which can be especially important during a period of loss. If faith is important to you, participating in religious rituals or connecting with your faith community can be a way to find support and meaning during this difficult time. Question 5. Do I need to take medication to overcome grief? Not always. In most cases, grief can be overcome with time, social support, and self-care. However, if grief symptoms are persistent and debilitating, a psychologist or psychiatrist may assess the need for medication to assist in treatment. We have reached the end of the audio, How Losing a Loved One Can Impact Our Mental Health. Did you like this content? Share with someone who needs support right now.